Hello, I'm Hitinder Guram, the Associate Chief Clinical Officer for the CV Neuro subsegment. Michigan Medicine recently received the American Heart Association and Mitral Foundation's Mitral Valve Repair Reference Center Award. This award is based on objective performance measures outlined by professional society guidelines, and it helps patients and their cardiologists identify hospitals and surgeons with superior outcomes for mitral valve surgery. We would like to recognize and thank the mitral valve repair team in the Frankel Cardiovascular Center for their outstanding work and dedication to excellence in patient care.
Our mitral valve repair team is extensive. It really is a team that includes not just the surgeons, but a very skilled OR team, outstanding imagers and cardiologists, and even beyond mitral valve surgery, we have a very extensive team of doctors that evaluates patients for all the therapies that we have for the mitral valve, ranging from open heart surgery to minimally invasive surgery, which we have a lot of experience with, to catheter-based techniques where we can fix the mitral valve with a single needle stick.
The benefits of mitral valve surgery compared to replacement are well known. Several studies have demonstrated that when you repair your valve, you basically are putting one back on a normal survival curve. You pay a price if you replace a valve in certain types of mitral pathology, meaning that your survival is lower. Therefore, we do everything we can to repair your valve and give you the best outcome.
The average surgeon in their life may do about 150 cases of mitral valve surgery in their entire professional career. And we have surgeons here who have done thousands and thousands and thousands. It is really the volume effect, but not only for the surgeon, of course, but for the center. Then the center, the ICU, the nursing staff, the referring cardiologist, everyone who takes care of these patients, it becomes very routine and we become very good at it. That is what makes Michigan Medicine unique in mitral valve surgery.
The Matrix team stands for Mitral and Tricuspid Interventions. It is a program which offers transcatheter repair and replacement options for mitral, tricuspid, and sometimes pulmonic valve dysfunction. Our population is many times considered high or prohibitive surgical risk. Many of our patients have undergone previous open surgical interventions and are now in need of additional surgery. As a mitral repair reference center, the Matrix team is able to offer additional transcatheter tools to aid our surgeons in mitral repair. This helps offer more opportunities and hope to our patients, which is truly the Michigan difference.
I learned in May of 2016 that I had through my primary care doctor, that I had a serious mitral valve issue. And I did some research. I came to the conclusion or decision that repair of my mitral valve was my preference at my age, being in my mid-50s then, as opposed to a replacement. So I did further research, which led me to Michigan Medicine, University of Michigan, and Dr. Bowling. I had a pretty sensitive time schedule to meet, having just found out about it in May and trying to have an operation occur on July 1st. So it all worked out wonderfully. And again, I felt the University of Michigan, Michigan Medicine group was just very attentive, very professional, and very efficient, and cared about me, cared about my time, and cared about my comfort. And so for that, I was very thankful, and I would recommend it readily.
The Michigan Medicine experience for patients, I think, is very unique because we have surgeons that have expertise in repairing mitral valve, but it's not only that, it's the whole approach to care and focusing on each patient as an individual and giving them the top priority that they deserve. Coupled with the expertise and focus on patient care, I think patients experience the best outcomes and long-term rewards from this intervention.
Obviously, it's a serious surgery, and I never lost confidence in the University of Michigan and their capabilities and of making sure that I lived through the procedure and would be healthy going forward. And I am that, alive and healthy going forward, and I'm thankful for that.
What this award really means for our team, it's more than just the surgeons. The surgeons have been doing this for a long time. However, this is really a recognition to the entire team, the OR team, the nursing team, our coordinators, our imagers, our cardiologists, and the list goes on and on. It really is a testament to how much they have worked hard to give patients the best outcome possible.